on the air tonight with breaking news. An American Ebola patient is coming to Omaha.
Missionary Dr. Rick Sacra is already on his way here. His wife says he walked onto the plane on his own. He's expected to fly into town tomorrow morning to start treatment in the Nebraska Medical Center's biocontainment unit.
KETV News Watch 7's Jeremy Maskell just heard from doctors at the Med Center. He joins us live.
And Brandy and Rob, this is what everybody both in Omaha and the country is really talking about right now. The very first time the Nebraska Medical Center has activated its biocontainment unit, the largest of 4 of them in the country, housed on the 7th floor of the University Tower building here behind me. Now, even though this is the first time staff have activated the containment unit since it opened in 2005, staff have drilled for diseases like Ebola or smallpox at least 4 times a year to make sure they can most effectively treat patients, protect themselves, and protect the community at large. Now, take a look at a tour of the biocontainment unit we showed you in August, just hours after the U.S. State Department toured the facility, asking if the Nebraska Medical Center would be able and available to treat a patient with Ebola as the outbreak spread even then in Africa. More than 30 staff members volunteer to serve in this unit when it is activated. It's able to hold up to 10 patients in all right now, though only holding 1 patient starting tomorrow. And here also is a look at some of the safety equipment staff say makes it one of the safest places to treat the most dangerous diseases in the world, from air pressure that seals it from the rest of the building to video conferencing, allowing doctors and other specialists to see patients without actually coming into contact with them. Now, just more than an hour ago, here's how one doctor described the lessons they've learned from Emory University Hospital and patients with Ebola treated there.
This is also based somewhat on the Emory experience, and we have discussed this with our colleagues at Emory University and to determine the most appropriate equipment that we should wear to protect our healthcare workers. The healthcare workers will, as someone mentioned earlier, have a partner involved when they put on and take off this personal protective equipment to ensure that it is done in a very meticulous manner and that there aren't any breaks or any concerns with the, we call it the donning and doffing of personal protective equipment. They will also shower out when they leave the unit. We have a decon shower as well as a hygienic shower, and so everyone will shower out on the way out. We have a lot of protocols in place, and these have been very well thought out, drilled previously, and again are sort of to provide optimal protection for our healthcare workers.
And they say that protection also extends to the greater Omaha community by protecting themselves. Now, doctors today would not talk about the logistics of getting that American doctor with Ebola from a metro airport to the Nebraska Medical Center biocontainment unit here behind me, but they do say it is a plan that makes sure everyone stays as safe as possible. The risk of exposure extremely minimal, they said multiple times throughout the press conference this afternoon. I also did confirm within the last hour that a U.S. State Department representative was on site here at the medical center behind me today working on that logistics plan for tomorrow morning, again, when they anticipate that American doctor infected with Ebola to arrive here for treatment at the largest biocontainment unit in the country. Reporting live, Jeremy Maskell, KETV News Watch 7.
Jeremy, thanks.
Again, the doctor, 51-year-old Rick Sacra. He's from Boston, but decided to go back to Liberia. He'd been there for about a month, delivering babies with a missionary group called SIM. Sacra went back even after 2 of his colleagues contracted Ebola, knowing the risk.
As Rick wrote to his medical colleagues, this epidemic is a wildfire about to rage out of control.
Now, that is Sacra's wife. She says she's been told her husband was clearly sick but in good spirits when he boarded the plane for America. 2 other American doctors have been successfully treated for Ebola at an Atlanta hospital. Nancy Reipel and Ken Brantley are okay. Doctors say they are confident the 2 pose no public health threat. The experimental drug used on both of them, Z-MAP, is no longer available.
As for Ebola, it is only transmitted by direct contact with blood or bodily fluid. It is not an airborne disease. Fatality rate can be up to 90%, though. It has ravaged parts of Africa, people who have little to no medical care. Those with Ebola have high fever, severe headache, weakness, and muscle pain. Symptoms do not show up until 2 to 21 days after being infected.
Now, the decision to fly Dr. Sacra to Omaha wasn't taken lightly. It involved high-level talks with the U.S. State Department, the CDC, and several departments of health. We were at the biocontainment unit just last month when a U.S. State Department representative took a tour of the facility. Again, we're told this is one of 4 in the country uniquely prepared to handle cases like Ebola.
We're here and we're ready.
Doctors say because of the precautions and the heaviness of the gear, a total of 5 people at one time will be treating Dr. Sacra, but many more will cycle in and out to help with patient care. Late this afternoon, the Nebraska Department of Health and Human Services released a statement about Dr. Sacra coming to Nebraska, saying, quote, DHHS and the Nebraska Medical Center have been partners in preparedness for more than 10 years. Building the unit was a joint effort, and so is the decision to open it. It's a decision that requires careful consideration. Adding, we have the facility, we have the expertise and training, and we have a person who needs help. We believe we can safely open our doors and provide the best possible care while protecting the public. We have more on this Ebola case on KETV.com right now, including the entire press conference this afternoon from the Nebraska Medical Center and why the general public, including anyone currently there, is safe. No one is in danger of contracting this deadly virus, according to those experts. Plus, we have answers to some of the top questions the health department is getting about Ebola and a link to their website. It is all on KETV.com. There's also been a hotline established. You can call if you have any questions. 402-444-3400.